anyone who suffers from excruciating back or neck pain, and most will tell you that practically nothing can be worse. In fact, for many, the pain can be so bad they actually stop working. They stop going out. In effect, their life comes to a halt. The causes can be anything from injuries on the job to automobile accidents to birth defects. Fortunately, for residents of the San Antonio area who suffer from similar problems, or even many others, they now have access to one of the most highly regarded and experienced orthopedic and spinal surgery specialists in the country today. His name is Dr. Stephen Sear, a board-certified and fellowship-trained surgeon who also trained at the renowned Mayo Clinic. Dr. Sear spent many years at the Air Force, where he was chief of spinal surgery for the entire Air Force, and also spine surgery consultant to the Air Force Surgeon General.
I think that one of the most important things that a surgeon can have is the ability to remain cool under pressure. When we do complex surgeries, no matter how well trained and no matter how prepared you think you are, every patient's experience, every patient's surgery shows you a different perspective. And sometimes things get really nerve-wracking, and the experience that I had in the war effort, I think, will always give me that level of peace and calmness under pressure, regardless of how bad it is or how busy things may be. I think that it will give us the ability to provide the best level of care with the coolest head possible.
What's special about Dr. Sear's surgical techniques is that he's not a one-trick pony. When it comes to a cervical spine, we can approach it through the front, we can approach it through the back, we can fuse it through the front, fuse it through the back, we can do minimally invasive procedures through the back. I mean, there's so many different things that we can do. You know, with regards to the lumbar spine, it's the same thing. If the patient needs a disc replacement, we can do it. If they need, you know, a transforaminal endoscopic discectomy, we can do it. If they need a miter procedure, we do it through a little 14-millimeter incision, we can do it. So we can tailor what we do to what the patient needs. Whatever is the best procedure for the patient is what we're going to do.
I think that as a spine surgeon, as time goes on, more minimally invasive techniques are going to become the forefront of what we do. My training at the Mayo Clinic was primarily large operations, scoliosis surgeries, big trauma surgeries, tumors, reconstructions, revision operations, and so they tended to be really large revision open surgeries. However, as time goes on, we're trying to find more minimally invasive ways to address the same problems with equal benefit.
When you talk about doing minimally invasive surgery, what does that really mean?
One example is that a traditional disc herniation is treated with an open incision that's a little bit more than an inch in general. There's a little bit more muscle trauma. There's a lot more recovery involved because the muscle is basically stripped of its attachments to the bone. The muscular innervation is at least temporarily halted because of the trauma that the muscle suffers from those types of operations. And as time has gone on, we've made that operation smaller and smaller. And now we're doing truly endoscopic surgeries where the incision is no more than 7 millimeters large. And hopefully we're providing the same level of benefit.
And the key question is, what does that really mean for the patient?
It means faster recovery, less pain, less morbidity, hopefully return to work, which is our goal. We want people functional. We want them to be back out there enjoying life and enjoying their functionality as soon as possible.
My story is about 2 years before I came here. I actually injured my back lifting my mother up off the floor. And I'd been active in weight training, weightlifting at that time, but when I lifted her, I just felt a compression in my back and a lot of pain, and I figured I just pulled a muscle. But once I got back home, after a couple of weeks of laying off exercising, it didn't ease up. I went to one doctor. They just threw a bunch of pain pills at me, antidepressants, didn't really do anything. When I came here and they did my MRIs and the X-rays, they saw that my L5-S1 disc was essentially blown. And then the L5-S4 was pretty much on its way to doing the same thing. And they recommended the surgery to replace my 2 discs. Been doing awesome. Without that surgery, I wouldn't have the smile back. I was in pain, chronic pain for 2 years. And they really listened to you.
My neck was broken, and I had seen a local physician and had performed 2 surgeries that were not successful. I had gone through physical therapy, and after that one physician had completely finished with me, he had referred me to 3 separate physicians, neurologist, PM&R doctor, and physical therapy. I didn't want to go that route. I was referred to Dr. Sear. He was able to see me and evaluate me, and in no time he was able to figure out that I was misdiagnosed. He performed extensive surgery, and he was able to get me off of 8 different types of medication. Previous to the surgery, I was in a lot of pain. I could not work. I'm a pharmacist, and I'm able to work long hours. I'm on my feet up to 16 hours a day, and I have absolutely no problems at all.
I hope that my practice is the all-encompassing spine practice. One of the most important things I think that we offer is a very conservative approach to spine. We're willing to do the larger operations if necessary, but at the same time we focus on avoiding surgery. And even though I'm a surgeon, I hope that what I'm providing for my patients is the same thing that I would provide for myself or for my family if they were to come see me. If they don't need surgery, they don't get surgery. I send them for non-operative treatment. I believe in rehab. I'm an ex-football player, so I'm an ex-athlete. I still lift weights to this day. And I believe that being physically fit is an enormous part of feeling good. And with back problems, my focus always centers around the non-operative modalities before I even consider surgery. So if I could send somebody to therapy, if I could send somebody to rehab, if I could recommend a personal training program, if I could send them to a pain management doctor who can provide them with injections and medications, and all the non-operative means that we have to treat back problems, that's what I do. And I only consider surgery when everything else has failed.
You know, the truth is, when he tells a patient, look, I'm going to do the best for you, I'm going to do for you what I do for my family, it's the truth. You know, when I do a procedure with Dr. Sear, it's not about how quickly can I get them in and out of the OR, it's about doing the right thing for them so no corners get cut.
A look at one of the country's most remarkable orthopedic and spinal surgeons today, Dr. Stephen Sear, here at the Orthopedic and Spine Institute. I'm Doug Llewellyn reporting from San Antonio.